Welcome back to Abortion 101. Today, let's chat about misoprostol. So what is it? Misoprostol is one of two medications that are used in medication abortions, and its job is to make the uterus contract and the cervix soften. So it gets the muscles of the uterus to actually kind of cramp down, and it gets the cervix to soften. And so that's why we have that cramping and the bleeding that empties the uterus during the medication abortion. But here's the thing. Misoprostol isn't just used for abortion care. It actually has a ton of other jobs in reproductive health care. It's also used in pregnancy and labor to help ripen the cervix and start contractions, specifically during inductions. It's also given after birth to treat heavy bleeding, known as a postpartum hemorrhage, because those same contractions are what help the uterus clamp down and stop the bleeding. It's also sometimes used before an IUD insertion, where one can be inserted into the vagina to help the cervix open and soften, so it makes it a little easier for the IUD to pass through. And outside of reproductive health care, it can even be prescribed to prevent stomach ulcers in people who take certain medications long term. I want to walk you through how it works, and I'm going to try not to lose you. So misoprostol is a synthetic prostaglandin. That means that it mimics a natural chemical that your body already makes. Prostaglandins are responsible for things like pain, inflammation, and in this case, uterine contractions. That's why misoprostol is the medication that kicks into motion during an abortion. So in this FDA-approved combination, you take 1 tablet of the mifepristone, which we talked about in the last video first, and then you take 4 tablets of the misoprostol 24 to 48 hours later. Sometimes that gets repeated. And here's something important to know. If mifepristone isn't available, misoprostol can be safely used on its own. Sure, the dosing looks a little different. It's usually multiple rounds spaced out over a day or two, but decades of international research and real-world use have shown us that misoprostol-only abortions are safe and effective. The World Health Organization officially recognizes it as a recommended method of abortion care, even when used alone. So whether you hear it called the second pill or the miso dose, now you know exactly what it's doing and why it matters. Thanks for coming to class today. You're officially fluent in Miso 101.